Hi everyone, welcome to Your Nurse Voice Matters. My name's Wendy Trevathan. I live in beautiful Brisbane, Australia, and I'm so happy that you've joined us for our podcast around raising your advocacy voice for nurses. This is a podcast where you can be inspired, where you'll hear plenty of stories, where you'll hear from experienced nurses and nurses that do have something that they want to say. And I'm so pleased to have a very experienced nurse that I've known for quite a long time. And you'll understand why in a moment. Anne James from beautiful Tasmania. So, welcome, Anne. I'm so happy to have you here.
Yeah, thank you very much, Wendy, and I'm very, very pleased to hear. So, who's going to let the cat out of the bag as to how long we've known one another? Yourself, or shall I do it?
Well, if you want to put it to the day count, probably, as old as I am, because Anne is in fact my sister, and I'm super proud of her. And just delighted for her to be one of my initial guests on this podcast. So, yes, I did follow in my big sister's footsteps and became a nurse. But you'll hear more about Anne in a moment. But I want to formally introduce you because nobody out there knows what Anne has done. So let me introduce Anne James. So, Anne James, a retired registered nurse with a unique perspective gained over 4 decades of experience. She's journeyed through different healthcare disciplines and this has led her to discover her true passion in general practice. As the lead nurse in this setting, she spearheaded innovative one-on-one nurse-led clinics, emphasising chronic disease management and personalised care planning. Her commitment to patient empowerment gave rise to the transformative mantra, "You are the VIP of your health journey," igniting profound changes in countless lives. Yet Anne's expertise extends beyond the professional realm. It is very deeply personal, and I think you'll hear a little bit about that story as we move along. Confronting a chronic di- sorry, a, Confronting a chronic illness diagnosis later in her career, she intimately understands the trials and triumphs of navigating life with chronic disease. Following retirement, Anne and her husband relocated to a serene Victorian cottage nestled in central Tasmania, where she delved into writing, exploring poetry, and historical fiction inspired by her tranquil surroundings. Despite stepping away from formalities of nursing, Anne's passion for healthcare persists through VIP Health Mastery, a program aimed at empowering individuals to seize control of their health journeys and emerge as the cherished VIPs they are destined to be. Oh my goodness. And that is an introduction that speaks so many volumes. So, oh my goodness, Anne, where shall
Hello.
we start?
How's about right back at the very beginning?
Exactly. So let me just open up the doors to for you to be able to share with us, your background and the big reasons why you became a nurse in the first place.
Right. So my background, which in many ways aligns with yours, although there's that 5.5 year, not that that makes any difference these days, gap, was not that there was any big aha moment to deciding to become a nurse. It was just something, particularly in my later teenage years, that I intuitively knew I wanted to do. There were two pathways completely diverse from one another. One was computer programming because I grew up in the era where computers initially came into the schools and what have you, and I loved that whole concept. And also the sciences, in particular biology and the human body. But aside from that, it was also a desire to help, a desire to nurture, because that is part of me. So as I said, no great aha moment. However, I was guided to the decision by mum and dad, most especially. And I'm very, very, very thankful to them that I did that. But it didn't take long until I had started nursing when I did realize that nursing wasn't just what I wanted to do or what I was doing, but was becoming part of who I am. And it is still part of who I am today, even though I am now a retired registered nurse, because it is written in my DNA. And there were many other aspects that will go along as we go along, sorry. Obviously, we will talk about that. As a child, yes, I played dress ups. I always wanted to be the nurse when we did dress ups, but that was just an instinctual, intuitive thing. So no real aha moment as such.
No, and likewise for me, like I left school at year 12, and for 12 months I really didn't know what I wanted to do,
Mm,
despite us having a really personal connection with
mm.
healthcare system, and you went off and did your nursing, and I went, oh, it was sort of like you'd gone to another world where you had disappeared for a while and very preoccupied when we came together as a family group. And,
Mm.
I remember the uniforms and the stories and all that sort of thing. So maybe, from your background and particularly like your nursing training, can you tell where did you train? Like, yeah.
So it was an apprenticeship. So
Mm.
I entered nursing in 1978, and it was an apprenticeship. I was indentured to a private hospital in South Hobart. It was at that time run by the Church of sorry, the Church of England Church. And yes, it was very rigid and matron-like. And think about all the old movies. Think about Call the Midwives, for instance. Back in the early days, it was very much along those lines. And we had to board. That was one of the requirements in that first year. So it was my first time leaving home, first time being away from mum, dad, and yourself. And of course, yes, with that gate, yes, I did suddenly disappear out of your life for weeks at a time. And it was a whole new way of life for me. And we did blocks of in the classroom, and then we were on the wards as nurses, as student nurses,
Mm.
and sort of gradually made our way that way. And it wasn't until I had finished my registration, finished my training, became a registered nurse, and was working. In fact, it was in the 80s where everything changed, where there were the
Mm.
big strike actions and what have you, and where the whole face of nursing changed here in Australia in particular.
Mm, mm.
Yeah.
And that,
And what,
mm,
sorry.
I was going to say, towards the end of your training, did you have any aspirations of knowing where you wanted to be, or did that come until later? Because we'll move on
Mm,
to what happened after your training.
mm.
After, yeah,
None
yeah.
whatsoever. All I
Mm,
knew was that I wanted to be a bedside nurse.
mm,
So I wanted to work within the hospital at the bedside, caring for the patient day to day. I wanted to help. I wanted to help the sick. I wanted to help the injured, to help those recover post-surgery, post-illness. And very early on in the piece during my training, I faced death and dying.
mm,
So I'd only been out from what we call prep block by a matter of a couple of months, where myself and another student nurse in the same year cared for a patient who was dying. So I had that experience. Far from frightening me away from the whole thing, it did take the fear of death and dying away from me, but
mm,
enabled me to see that sometimes you just needed to be there and hold their hand. There was not much else that you could do. So it was to give them grace and dignity during that dying phase. So I knew that that's where I wanted to be. Um, I'd had enough of academia by that stage,
mm.
and I just wanted to get
Hadn't
on
we
with,
all? Goodness
yeah,
me.
get on with the job and the nurturing side and nursing. And of course, I was engaged before I became a student nurse. I got married towards the end of my second year of nursing, so I was newly registered and fairly newly married. And then within 2 years of finishing my registration, I became pregnant through choice and became a young mother as well. So I was combining all of those things.
Mm, mm. And then during, I think it was your second or third year, of course, we had the life-changing experience personally.
No,
Where,
it was
where
actually
were
when I'd
you?
finished. I'd finished
You'd
registering. I'd
finished, yeah,
finished. So
yeah.
that was in 1983. So
Mm,
I was actually third year post registration by that stage. Yes. So
yeah.
you go on to start that.
Yeah, so that was a pivotal moment for me
It
that
mm,
um that I didn't realise that was the impetus for me to do nursing a few years later. Our father developed a disease called Guillain-Barré syndrome and quite quickly went from being an able-bodied role model for both Anne and I to being bedbound and in ICU and in quite a critical state within 24 hours. And
Mm.
that was a pivotal moment. And the reason why I'm mentioning this is that it had a huge impact on me personally for the role of the patient within the family from personal experience. But when we talk about nursing, and anything that we do that is a purpose-led life, there is usually a pivotal moment. And for me, that was mine. What was yours, Anne? To
So my
actually say, nursing is where I want to be. That's where I want to go.
It was Dad's journey, as that pivotal to know that that's where I wanted to stay.
Mm,
Um, as a and it was not just the nursing either, it was the caring within the family as well. So it was that combination. And what I witnessed, because as I said, you were still in you're at matriculation college by that
year
stage,
12.
year 12, that's correct. And I was working at the Repatriation General Hospital at that. No, I wasn't. I tell a lie. I was back working at St John's Hospital where I trained. Um, part-time, but seeing how dad was cared for, mum was cared for, particularly in those initial days, and you and I, and even my daughter Danielle, who was 5 months old when dad became sick. So that was my pivotal moment to know that was the type of person that I wanted to look after. I wanted to look after the person who has a life-threatening illness, injury, or diagnosis and needs that critical care. But again, at that stage, being young mum, dad in hospital, working part-time, needing to look, care for mum and to you at a lesser degree, but being involved, I
Mm,
knew I wasn't ready to go off and do any postgraduate certificates or
mm,
anything like that. That was going to be one load too many for me. But it did give me the desire to care for people in that situation.
that chronic
Mm,
area. And
mm.
certainly after that period of time, when things had settled down, for want of another words, you did actually go on to do other areas. Can you let
Indeed.
everybody know
Mm.
where that all led to and what happened? Yeah.
Absolutely. So I did work in various disciplines through in acute care. So as I said, I'd gone back to St John's Hospital post pregnancy, working in their pediatric ward of all places, 2 nights a week. That then led me on to the Repatriation General Hospital, and again I was working general surge med, or looking after veterans a lot of the time. And then when I went back to work after my son was born, I went to another private hospital called Calvary, again working general medical surgical, doing some neurology work on the neurology department ward as well, and high dependency. And they just started a small 4-bed intensive care unit in the private hospital. And I was asked one night if I would be second person in because they'd had an increase in patients in their intensive care unit. I would be under the direct supervision of an intensive care trained registered nurse. I said yes, put my hand up immediately and said yes, went in, loved it, and I stayed. And
Mm,
I worked in intensive care for 22 years,
mm,
predominantly night shift,
mm,
full-time night shift, and I learned on the job.
mm,
And it was challenging.
mm,
It was demanding. There were many nights, mornings when I would come home in tears. But it was tears of compassion. But I knew that that's what I wanted to do at that stage, and so I continued to do that.
And
Mm.
I remember that time because
Mm.
your knowledge of the acute situation, whereas my journey was more medical general.
Mm,
Your acute care knowledge. If we had discussions around a particular patient diagnosis and treatment, you would add another layer of information to me. So you're always sort of like 6 years ahead of me, which is inspirational in its own right. Um, and what happened, after that period of time? Like I know, but the audience
the
doesn't.
audience don't know. So I actually had an injury first up. So slip disc, cervical spine, and required cervical spine surgery. One of those surgeries that I never wanted to have.
Mm,
So I had that. I took the time at that stage to give myself time to heal and decide what I wanted to do from there. So I actually, after the sick leave, I took long service leave, and towards the end of that, I knew that I was ready to transition out of acute care, but
mm,
not completely sure of where I wanted to transition to. So I did some in-home palliative care night sits, which was very humbled to do that. And I learned a lot there, greater depths of compassion and empathic listening. There and in aged care as well, there as a registered nurse in an aged care facility. Enjoyed it. However, I felt like I was treading water there. From there, I transitioned through to community home care. So that was as the registered nurse in charge of the aged care home care packages, totally called things totally different to what they're called now.
yeah.
And I would supervise those. Then once again, I realized I was treading water. I did a Medicare funded chronic disease nurse management course for my own benefit, and I realized general practice was where I wanted to go to, but not just, although very vital, to do dressings and take temperatures and do blood pressures and give vaccinations, but to really help people in the community manage chronic disease. So I found a position, went into general practice and develop my own role within general practice with the support of our boss, who was a general practitioner herself. So that
Mm.
started that journey.
And you had an opportunity to open up things within that general practice, didn't you? You saw
Oh,
something that was a bit of a gap. Do you want to tell the audience what that
absolutely.
was?
Yeah,
Mm.
absolutely. So we had an absolutely wonderful diabetes nurse educator working within that role at the time. And I had gone off to do an asthma education course, and I wanted to implement asthma clinics 1 day a week within the practice. We just started to set that up. So that's where they'd come in and they'd have some um, asthma education training with myself and then in to see their GP afterwards. Our diabetes educator retired, and the general practitioner who was the boss of this, because it was a private clinic,
Mm.
who owned the clinic, came to me and asked if I would sort of take over part of that role, just doing some education and further education in their chronic disease management planning, to continue that continuity of care. When I started seeing these patients, their diabetes very, very well managed, but many of them, in fact, the majority of them, had a lot of comorbidities. So other chronic diseases, first and foremostly cardiovascular disease, you name it, arthritis, COPD, asthma, renal issues. And they were being not so much swept aside, but the attention wasn't being paid to them, and complications and potential complications were beginning to filter in. So I made a case for implementing and running one-on-one nurse-led clinics on chronic disease management. So that
Mm.
is utilising what's available here in Australia with the Medicare funded GP management plans, and so it's general practitioner management plans and team care arrangements. But I had to make that case to the owner of the practice that this would work for the patient, for the practice, on multiple levels. So from a patient outcome point of view, from a practice satisfaction point of view, and it will also so that it would run efficiently and economically,
Just to
which I
put this,
did.
yeah, you did. And just to put this into context, like we hear a lot about nurse-led clinics now. What
Mm,
year did that take place? Because it wasn't, it was before its time. It
it
was
was
you
somewhat,
were
yes.
you were a you were setting the benchmark, really.
I was within the practice, yes,
Yes.
absolutely,
Yeah.
and elsewhere, just quietly doing my own thing, absolutely. So it was, I'm just trying, just harking back now, so just bear
Mm,
with me, 2009, 2000, so I went into general practice in 2009.
mm,
19, 20, 21. Yes. It was 12 to 18 months later. So it would have been the end of 2010, beginning of 2011 that I
mm,
really got it. And it was just 2 days a week to begin with. Then it went to three, then it went to four, and it became full time. So I had 4 clinical days with the patients and I had one administration day. And they would see me. Yes, we would do the normal blood pressure, weight, height, check their vaccination records, but um, I would look at all their other clinical necessary bits and pieces prior to them seeing the GP. But we would then sit down and we would talk about how they were feeling, what was bothering them, what was most important to them, what their barriers were to working through those clinical goals of care that are important in stabilizing conditions and preventing complications. And they would spend up to an hour with me, but it meant that by the time they got to see the GP, they only had the more complex issues. So there was no diagnosing, there was no prescribing or anything like that. But we had done all of the necessaries. I then would put the care plan together on behalf of the patient and the GP
mm,
so that all that paperwork was done as well. And
mm,
it just streamlined, and they were forward booked into a review appointment either 3, 4, 5, or 6 months ahead so
mm.
that there was continuity of care.
Excellent. That like people say, you go to your GP and you've only got 10 minutes, and that kind of is a gap that only now people are seeing the value of spending that amount of time with a
Mm,
client to be
mm,
able to prevent the reoccurrences back to the
mm,
GP.
mm.
Um, and that sort of experience has led you to move into an area now where you're not so much clinically focused, but you're doing some other exciting work. Did you want to
That's correct.
share with the audience what you're doing now?
Well, I will, and again, to give that backstory to that. So, April 2018, I'm sitting at the desk, I'm ordering the vaccines for that year's flu clinics,
Mm,
and I became medical term blah. I had a temp of 40 degrees. I couldn't move. I couldn't lift
mm,
my head off the desk. It turns out I had an influenza B infection. That influenza B infection resolved after 2 to 3 weeks, but I had lingering symptoms and ongoing symptoms. And the upshot of that was that my immune system decided it would go party, and I developed autoimmune conditions. So it was the challenge of working with that. Fast forward through a number of reviews, seeing rheumatology, going on to medication. So I became the patient on the other side of the desk. I thought I had a handle on. No,
mm.
not when you're the patient on the other side of the desk. You don't. I went through
No.
everything that every person newly diagnosed, particularly with a chronic illness, goes through. I guess the heads up that I had, or the stepping stone forward that I had, was I knew what I needed to do. I still had to go through the process of doing it, but it did eventually lead to me making that decision to retire, as I
Mm,
could no longer work effectively in a 9 to 5 sit down at a desk job.
mm.
I then decided to give up my practicing certificate because I knew I would no longer go back to nursing, and I thought that was going to be it.
No.
It was you that started this next process. So you said to me one day you had written two of your books by that stage. Yes, your first two books by that stage. We were talking about what I was doing here, and you said you should write a book. I said, no, not me. And what did I do? message you later and said,
24
you,
hours. Yep.
yes, I'm
Bugger
going to.
me.
And I started, which was my memoir. And of course, it was as I was doing the chapters on becoming a nurse and then going through what I called in my memoir a life-changing moment, that made me realize that I had a heck of a lot of knowledge tucked away in the old grey matter that
Mm,
needed to go out. And it led to me writing my next book, funnily enough, called Beyond Limits, Navigating Life with Chronic Disease. And that led me to realizing that I had even more and that I wanted to serve and to share and to help other people going through the various stages of navigating their lives with chronic disease. So that's what I'm doing now. It's also amplifying my voice and my message, and also helping other people to amplify their voices and message.
For those that are on YouTube, do you have your book with you?
I do. Bear with
Yes.
me. I have my
Yes.
author copy. It's tucked in my drawer here, and I'm now putting it up so that you can see it.
Excellent. So that's Beyond Limits,
Hmm.
which you'll find on Anne's website, and we'll share Anne's website as a part of the outgoings from this podcast and the YouTube link. So
Hmm.
thank you. I guess throughout all of that, like, how inspiring is that to actually go, live, lived experience, your own experience, and then moving on, still with that drive and that inner purpose to help others.
Hmm.
What is your current message about for our nurses out there when it comes to advocacy and speaking out? What advice would you give?
Yep. All righty then. So advocacy and speaking out. So your voice holds the power to influence not just policies, but also patient care, patient outcome, and also the culture of nursing. It also has the power to um, help build a brighter future for the profession,
Mm,
to stop the hurt culture that has crept in, and to develop a kindness, compassion, and support for one another, and that never, ever, ever um, be afraid to reach back to help the nurse behind you.
mm. Yeah, it is team. Would you say that it would be your number one key tip? What would be your gold nugget, your key words of wisdom or advice
My
for
key,
nurses?
well, for a
Mm,
new nurse starting out,
mm,
okay, it is going to be that you will doubt yourself more times than you care to admit. But just remember that every moment of uncertainty will become a catalyst for growth if you allow it to guide you forward.
mm. Oh,
Mm.
that's awesome. I think every nurse out there that is probably struggling with their day, that
Mm.
is, there's some key advice, is that it's probably just one day to soldier on and to continue on, and to understand that their role is a key in the cog that to keep the healthcare
Mm.
moving forward. So, and what's your website? If people were wanting to reach out to you, do you want to share your website?
Absolutely. So it is www.viphealthmastery.com, and there is a contact form that they can fill out
Excellent.
easily, and that'll come through to my email, and I'll reach back.
Wonderful. All right. So thank you very much, Anne, for spending some time with us today and to sharing, your personal story as well as some professional tips for nurses. And thank you, listeners, for joining us for the last half an hour of Golden Nuggets on Your Voice Matters. We'll catch you next time.
Bye.